Faith Community Nursing is an exciting and challenging specialty practice that combines care of body, mind, and spirit in the context of a congregation and community. Faith Community Nurses, also called parish nurses, church nurses, or congregational nurses, serve a number of roles: health advisor, educator on health issues, advocate, resource person, liaison to faith and community resources, teacher of volunteers and developer of support groups, healer of body, mind, spirit, and community. Most nurses enter the nursing profession out of a strong sense of call to care for others. Let us introduce you to a few faith community nurses from among the more than 10,000 health professionals working in this specialty practice across the United States and around the world.
I got into parish nursing when I was in graduate school for nursing. I really had not heard of parish nursing until I heard some of my colleagues at school talking about it. Even though I happened to be a Methodist minister's wife, I didn't know about it. So I got into it because it was an obvious wedding of my passions of my faith and my profession. So when I heard about parish nursing, I thought, this is for me.
I feel like God has called me and gifted me to be able to work in the Cathedral of Health, because this is the place where I think the real, and this is what Reverend Granger Westberg used to say, healing really takes place. The real place of healing is in a church and a congregation.
I had been in nursing for a long time, had worked in many different specialty areas, and I always knew there was something more that people needed than just their physical care. I never felt like I really had time to do it, and I never felt like I was really prepared to do it. Then when I heard in parish nursing that we are to intentionally meet spiritual needs too, I thought, this is what I've been missing.
It seemed to be exactly what I went into nursing for originally.
Parish nursing offers registered nurses an opportunity to use their skills in an autonomous and collaborative practice that is based on trust, respect, and connection to others.
I would say the flexibility of the position, the creativity that you can have. You can identify a client's needs and do client advocacy, and if you recognize that it's a community need, you can do entire community advocacy. You can develop a program within the community, build a community wrapped around this issue. Examples of that is we've had parish nurses that there was no OCD support group, or there was no dental care and services for a certain population in our community. The nurses were able to build support for that, recognizing it wasn't just the client's issue or several clients' issue, it was a community issue.
It's very much health promotion, disease prevention.
Well, we have the advantage of having an ongoing relationship with them. The nurses in the hospital, people move in and out of the hospital so quickly that even if they're the most compassionate, greatest nurse in the world, there's just not time to establish that. And our relationship can go on for a number of years, and they do develop a very strong trust with what we do.
Because it's so different than healthcare in the hospital, where the person comes, that's the first time you know them, and they leave, and that might be the last time you will be able to interact with them.
Many hospitals support parish nursing as a way to reach out into the community.
If I ever need questions answered, or if I have problems, I'm not going it alone, just floating out there. I have some support that I can call on to, and I think that that has made a huge difference in my practice.
Many congregations develop health ministries as a way to provide holistic care to all.
Parish nursing is what I call womb to tomb. All other nursing is episodic. You see a patient for a while and then they're gone. But a parish nurse follows a family from over long periods of time, years. And so they get to see those people when they're sick and when they're healthy and when they're happy and when they're sad, and they really become a part of their life.
I started, and then I had another parish nurse that said, I like what she's doing, I would like to do that too. Then I had some social workers who said, you know, I could probably do that too. And then I have some people who are dietitians, they all kind of got excited about it, and it just kind of grew bigger and bigger. So I think it started as a parish nurse ministry, which is still continuing, but I think it grew beyond that and became something that became more of what our church's feel is.
Body, mind, and spirit, that's what it's about. So that's what we try to offer to not only the folks in the community, but the staff, the parents.
And in Matthew 22, there's a great commandment and a great commission. And the great commandment is, you shall love the Lord your God with all your heart, with all your soul, with all your strength. And the great commission is, and love your neighbor as yourself. So parish nursing is certainly a way to live out the great commandment and the great commission.
Healthcare today is complex. People often need help navigating the health system for themselves, their children, or elderly parents. Faith community nurses build bridges that lead to better health.
The clients have great outcomes because you're able to establish a relationship, use your professional nursing skills to either manage chronic disease in collaboration with a physician, and use the congregation to support that individual.
When we're with people in our parish nursing role, they expect that we know everything about healthcare, and that's changing every day. So I think we're called to maintain our professional level of expertise because healthcare is very complicated.
Working under a scope and standards of practice approved by the ANA, nurses who want to become parish nurses complete a basic preparation course specific to this specialty practice. More information on classes can be found on the website of the International Parish Nurse Resource Center at www.parishnurses.org. The IPNRC also hosts an annual professional meeting called the Westburg Symposium and helps clergy, congregations, and health providers explore and grow health ministries in a variety of settings. Some faith community nurses work full-time, but most work part-time. Many are paid by the congregation, others through a health system or health foundation. Still others volunteer in their home congregations, often as part of a health ministry team. Many find that their parish nursing brings value to their work in other healthcare settings.
Many nurses work as parish nurses in addition to doing hospital nursing. And being a parish nurse just improves your hospital nursing or your office nursing. Being a parish nurse, that spiritual component, that spiritual dimension makes you a better nurse.
I really think that I sit at the best of both worlds by having a full-time position in the hospital as well as being connected to a congregational model.
We suggest you talk to other parish nurses to learn more about the opportunities and challenges in their work.
Search out parish nurses. Go and visit with them, walk with them, journey with them, and see if that's something that you would like to do.
I guess I use everything I've ever learned in nursing over the last 30 plus years, and then I'm learning every day.
Through faith community nursing, many experienced nurses find new meaning, which re-energizes their hospital-based work. Some nurses pursue parish nursing long after retirement from other healthcare settings.
In my years of nursing and working in a lot of different areas, whether it's mission nursing or United States nursing, that it's probably the most satisfying type of nursing that I've experienced.
To be surrounded by such people that give so much and expect so little, it's wonderful.
As Helen told her priest, they can't afford us.
So you might
and
not
that's
give
why
us
we're
any.
volunteers.
To find out if faith community nursing is right for you, visit the website of the International Parish Nurse Resource Center at www.parishnurses.org or call 314-918-2559.